Welcome back and thanks for staying with us. One of Jamaica's leading nephrologists is advocating for more resources to be allocated to treat kidney disease as experts grapple to provide care for the sick. Jamila Maitland explains.
Imagine being diagnosed with chronic kidney disease. Then, imagine having to go to the hospital 3 times per week for treatment for years. That's the reality of thousands of Jamaicans. According to Professor Everard Barton, dialysis has seemingly become the long-term treatment therapy for people with kidney disease in Jamaica.
We need to have a more active kidney transplant program.
Professor Barton, who was speaking at the Jamaica Medical Foundation annual general meeting on Tuesday, says he has patients with kidney disease for more than 3 decades. While it's no death sentence, Professor Barton says treatment is a life sentence, which can be exhausting and expensive. He says the ultimate goal should be kidney transplantation.
I know a young man who was 33 on Valentine's Day, and he had been on dialysis for 16 years. Also, I know a woman who has been on dialysis now 36 years.
The issue is that Jamaica does not have a kidney bank or an active donor transplant program. Professor Barton admits that treatment for kidney disease has come a far way since the 1990s. Back then, there were only 2 dialysis units.
We have at the moment about 9 nephrologists in Jamaica, 22 dialysis units.
For those suffering with the disease, however, that progress is not enough. Data shows that 1 in every 7 Jamaican may suffer from kidney disease. And with fewer than 2 dozen dialysis machines in the public health sector, Professor Barton says prevention is the ultimate way to go.
Based on data from the Caribbean Renal Registry, the pattern throughout the Caribbean is the same in terms of cause of kidney disease. Hypertension and diabetes lead the fray.
The recent tax on sugary beverages could be helpful, but for those who've already been diagnosed,
in order to slow that ball down, the blood pressure must be well controlled. The blood sugar must be well controlled. The cholesterol must be well controlled. Body mass index must be well controlled. And we give them the parameters.
Jamila Maitland, TVJ News.